So what is the surgery for people with a hole in their eardrum?
It's called a tympanoplasty, and it's for both people with a hole in their eardrum, and sometimes people can have chronic infection, or they can have issues with the way that their ear bones form that transfer the sound, where they get eroded and they don't hear well because of this.
Is this a younger patient or older patient?
It's everybody.
Okay.
You know, it can be from trauma to the eardrum, which there are a lot of water sports where we live, and that's a frequent lake trauma, is a hole in the eardrum. It can be also from prior ear tubes sometimes, and fortunately not very often, but the tubes will stay in too long and that hole doesn't heal totally. And then some people, they can have chronic infection and their eardrum ruptures, and that really hurts, honestly. And they can have a leftover hole in the eardrum and sometimes erosion of bones of hearing. So what we do is we'll either make a little incision in the ear canal, we can't see it, or behind the ear, take some tissue, usually either the cartilage right here inside the ear, it doesn't change the way they look, but take a little bit of that cartilage or a little bit of the muscle tissue right above the ear, and under an operating microscope, make a new eardrum. And sometimes we have to take tiny pieces of titanium. I mean, when I say tiny, really tiny, like under a millimeter, piece of titanium to rebuild or reconnect those bones of hearing. So we'll go in, surgically lift up the eardrum, rebuild those bones of hearing if it needs to be done with titanium typically. We'll lay the graft of their own tissue in there, put the eardrum back down, and then put some absorbable packing to hold it gently in there. Not a real painful operation.
Yeah, actually. So what's the downtime?
The downtime for most activities is just a couple of days. We do ask that people don't get any water in their ear for 4 weeks, because we don't want them to shift that very delicate graft around. We ask them not to blow their nose for a few weeks, because again, we don't want them to pop their ears and pop that new graft out of the way. And we ask them to avoid contact sports, things where they're really going to get roughed up, for about 4 weeks. But other things, they're going to run or go back to work, they're down just a couple of days.
And for the people that were in pain before they go in, how soon are they out of pain?
Well, honestly, if it's for chronic infection, they feel a lot better right away. Fortunately, most of the time we try to get the infection under control before surgery. But it's actually not a very painful operation at all. In the old days, before we had a little bit safer and more modern anesthesia, they used to do these with people awake.
Wow.
Just under a local anesthetic. We try not to do that now. It's just uncomfortable for people to take and lay there for that long and to not move. And we're dealing with really delicate structures. I mean, they're millimeters under a microscope. You don't want people wiggling around while you're reconstructing their hearing. But yeah, well, thanks for asking.